Welcome to Medit 360. Today we are going to talk about diabetes. It is one of the most common health conditions today, but what exactly it is? In this video we will break down in the simplest way possible. By the end you will have a clear understanding of what diabetes really is and why does it matter. So let's dive in. The basic definition of diabetes is that it is a condition where the blood glucose or blood sugar remains too high because the body cannot use it properly. This is also known as hyperglycemia. So this is what happens. Whenever we take a meal, the glucose in the meal gets absorbed and it enters into our bloodstream. From here, it needs to be taken up by the cells and utilized. But in order to do so, the cells need insulin. Here, the pancreas comes in. Whenever the pancreas senses a glucose load, it secretes insulin from the beta cells. And with the help of this insulin, the glucose is taken up by the cells and ultimately utilized. But in cases where there is problem in the pancreas, there is a deficiency in the insulin and the glucose cannot be taken up by the cells and ultimately the glucose rises in the blood. This is the pathophysiology of diabetes, in which an absolute or a relative deficiency in insulin leads ultimately to the hyperglycemia. Now let's talk about how common is diabetes mellitus. Diabetes affected approximately 30 million people in the United States in 2020. And approximately 84 million people have pre-diabetes. This number is progressively increasing at an alarming rate. Now let's talk about the different types of diabetes mellitus. There are various types. These include type 1 diabetes mellitus, also known as insulin dependent diabetes mellitus or juvenile onset diabetes mellitus. Type 2 diabetes mellitus, which is non-insulin dependent diabetes mellitus, also known as adult onset diabetes mellitus. There are other various types like LADA, latent autoimmune diabetes in adults, and MODY, which is maturity onset diabetes of the young. There are other types of secondary causes of diabetes, which includes acromegaly, Cushing syndrome, medications like glucocorticoids, atypical antipsychotics, or statins. We will discuss each of these types of diabetes in another lecture. Now let's talk about our last heading, the complications of diabetes. The complications can be divided into acute and chronic complications. The acute complications include fatigue, weight loss, excessive thirst, and frequent urination. The chronic complications in descending order affect the brain, eyes, heart, kidneys, nerves, legs. In the brain, it can lead to stroke and TIA. In the eyes, it can lead to retinopathy and ultimately blindness. In the heart, it can cause coronary artery disease and MI. In the kidneys, it can lead to nephropathy, and in the end stage, chronic kidney disease. In the nerves, it can lead to neuropathy, leading to pain, paresthesias, and in the legs, it can lead to foot ulcers, and in the extremes, amputations of the leg. Now you know what diabetes is, but how does it actually develop in the body? That's what we will cover in the next video, so stay tuned. I would also love to hear from you. How did you find this video? Was it helpful? Let me know in the comments. Also tell me what topics you would like me to cover next in the diabetes series or any other medical topic you are curious about. Don't forget to like, subscribe and hit the bell icon so you don't miss the next lecture. Thank you.